Welcome to this Breas tutorial series video. The Vivo 3 by Breas is intended for invasive or non-invasive ventilation for patients weighing over 10 kilograms. With its 4-hour internal battery and 3 patient profile settings, it can be used in a variety of ventilation modes. CPAP, pressure support, pressure control, spontaneous, spontaneous timed, timed, and auto EPAP and target volume settings are available. In addition, the Vivo 3 now also has a high-flow nasal therapy setting. This allows a dual profile setup of the device with both NIV and high-flow nasal therapy applications for use in the hospital and the home. To use the device for high-flow nasal therapy settings, activate and select a second patient profile via the Others menu of the device. When you enter the Setup menu, there is now a Profile option, which allows you to select a second or third activated profile. The active profile is displayed at the top of the screen. When you return to the Setup menu and select the high flow setting, you simply set the desired flow. This set flow must be higher than the level of oxygen being entrained through the rear of the device. The maximum amount of entrainable oxygen with the Vivo 3 is 30 litres per minute. When the device is locked into the home mode, the user can easily switch back and forth between the set NIV and high flow settings options, which have been set by their clinician. Thank you for listening. For more information on the Vivo 3 and high flow nasal therapy, please visit the Education by Breas website.